Alright, so we're actually trying to look at a whole lot of ways in which we can be able to examine women. Okay, basically trying to access, if there's possibilities of any abnormalities or a disease condition. So for gynecological physical examination, gynecology is just talking about women in general, while obstetrics, that's where you're now talking about women that are pregnant. Okay, so for this let's focus on gynecology for now. So let's talk about the physical examination. That's basically things you should actually be concerned about in physical examination. So for gynecological physical examination, we say that it's actually a comprehensive, it's a clinical assessment, and you are focused on the woman's reproductive health. Okay, you are focused on the woman's reproductive health. It's a cornerstone of preventive care, alright, diagnosis and management in gynecology, and must be conducted with sensitivity, professionalism, and clear communication. So what's the purpose of gynecological physical examination? The reasons to why you can be doing this gynecological physical examination is could be that you want to actually dictate for infections, you want to dictate for masses, you want to dictate for any anatomical abnormality. If I'm pressing here like this, I'm trying to feel all those solid stuffs. Then also to be able to be looking at the patient and see if they are reacting to pain. Okay, so purpose of gynecological physical examination is to dictate infections, masses, or anatomical abnormalities. Also to be able to screen for cervical and breast cancer, to be able to evaluate for symptoms like pelvic pain, abnormal bleeding, vaginal discharge. Okay, and after I examine the woman, I can now be able to know what is wrong with her, and this can help me discuss further with her in a better way. Now, components of examination is, first you have to do the general examination, which this one is not focused on the reproductive system. You just look at the general well-being of the woman. Okay, you look at the vital signs, general appearance of the person. You do a breast examination, you do abdominal examination for the person. Do you understand? That one is general. Then going on to the external genitalia examination, this one you are not in the genitals yet, you are just looking on the outside. What is the health, what is the appearance, is there any discharge? Do you understand? So on the outside, you are looking at the vulva, you are inspecting the labia, you are inspecting the clitoris, you are inspecting the perineum, you are looking out for lesions, you are looking out for ulcers, you are looking out for wounds, you are looking out for abnormal discharge, you are looking out for if there's a sign of a trauma. Then speculum examination, this one is where you now use this instrument to put it in the vagina to keep it open. So when you keep it open, you can just look with your bare eye, or you can now use a colposcopy. Okay, so this one will access for cervical appearance, vaginal discharge, also perform pap smears. The bimanual examination, this way bimanual, one hand into the vagina towards the cervix, then one hand on the abdomen. Okay, that's what we call the bimanual examination. Then rectal vaginal examination if needed, so one hand the rectum, one hand in the vagina, that's if needed. So key considerations: always obtain informed consent. Then you bring another woman, that's if you are a man. Even if you are a woman, you bring another woman to actually stand there as a surety. Okay, that's what we call a chaperone. Okay, so ensure privacy and comfort during the examination. Then avoid anything that is unnecessary. Okay, anything that is not of advantage to the patient, you basically keep it out. So that's what we have on gynecological physical examinations.